Callen-Lorde has been providing healthcare to people of transgender experience for many, many years, prior to there being any ability to formally be paid for them under insurance programs. And we've done so because it's the right thing.
It would be great if a trans person could go into any doctor and that provider would know how to give them compassionate care and appropriate care and knowledgeable care with sophistication and nuance and everything else. Unfortunately, that's just not the case.
Trans people need health care, but more than that, I think health justice is what's really needed.
Affordable health care, easily accessible health care is important for everyone. A transgender journey is usually one that can be very complicated.
People who come from the TGNC population, Transgender and Gender Non-Conforming, face a very special set of circumstances that are really unique to them and to me, myself.
There are all these unfortunate barriers. There are all these obstructions out there.
Housing, education, employment.
Anything from not being called the right name or pronoun to finding providers that are just completely unaware of their health needs.
I've had providers where I've had to tell them what trans healthcare meant. I had to tell them what kinds of hormones I needed, how much I needed. And I've had providers who acted quite inappropriately.
And so a lot of trans people find it very difficult to seek healthcare, especially in life and death situations where there really isn't a room for discussion. There are things that needs to happen. However, that person will sit at home and allow things to get worse before they get better just because of the treatment that they receive.
So when trans health is actually included in healthcare, which is just so rare, it means so much for a transgender person because it basically communicates that their health is important.
This says we just accept you for who you are, however you are, and we're happy to help you live the life that you want to live.
Not just about, oh, you need your hormones today, but what's going on with your health? How's your blood pressure? What other illnesses might you be facing? What else is going on in your life?
It changes the way people see themselves and how they walk through the world. It changes the difference between somebody who might be suicidal.
Callen-Lorde really takes good care of transgender people, but it's been a long process, and there's been so many different things that have been in place to help that happen.
The first official transgender health program that Callen-Lorde implemented, and by official I mean named as such, was in 1996. We started the Transgender Health and Education Program, as it was called.
And so the second Saturday of every month we would meet in a very small section of the second or third floor at the Gay and Lesbian Community Services Center, and we would set up our clinic.
People would come in for hormone care that they had previously been receiving on the streets at times, or from medical providers who, according to their patients, really didn't care about them.
No one knew what to expect. And the first day we opened the doors, we had 30 people, and it was amazing.
And it very quickly led us to recognize that if we wanted to make this a true, trans-inclusive health center, we had to broaden the service.
And so we came up with the idea of writing a set of clinical protocols.
We had a large group of people coming together, trying to both mesh their experience and understanding and with external experience and understanding, talking to external providers.
In order to put on paper what our standards were for providing hormone therapy in an informed consent model.
A lot of other protocols rely on an extensive evaluation period before allowing a person to access hormones.
The doctors and the people at Callen-Lorde and elsewhere who were creating this philosophy of care were really radical. It was really an activist thing to have this different perspective about how we could treat trans people and how trans people could live their lives.
Creating transgender hormone protocols and being a healthcare center that people look to get these hormone protocols was huge.
Trans health, I think, is incredibly understudied, I think shamefully understudied.
And I think Callen-Lorde took that on.
Training other entities, not only in New York, but in other parts of the country. And we're having visitors from all over the world that want to talk to us about transgender health.
We even have like ASA here who does the research.
So a lot of our allies in the legal departments that we have worked with in the past really advocated to make these changes. So they worked with some of our patients, some folks that were not our patients, to sue the state on behalf of them to say, you know, we've tried to get our surgery covered, these are medically necessary surgeries, and the state finally agreed.
Like with everything, there are lots of kinks to work out about how you get the surgeries, etc.
It still is a bit up in the air as to what these services will actually cover.
Certain people not being able to access certain things, like maybe top surgery or maybe some surgeries that's deemed cosmetic at this point in time.
You cannot routinely deny access for certain people, a certain segment of a population based on gender expression or gender identity. Like, that's just wrong.
Medicaid saying or dictating to us what we need, I think we're still at a great place because there's room for improvement.
Having transgender people actually at the forefront of that, actually saying, this is what we need for our healthcare, helps really engage them in care.
It's the right of the TGNC community to have somewhere to go.
I think it's very important that trans people have a safety net to live their lives just like other Americans do.
The programs, services that we offer help a person individually as a human being.
It makes me as a patient feel welcome. It makes me feel like I'm here as a whole person.
We tend to be a lifeline, you know, for some individuals, absolutely.
As a person of trans experience myself, it helps me to be able to give back to the community.
But overall, the community needs to have a place like this to look to.